If things were to go badly wrong, and we obviously hope and pray that they don't, in this country and elsewhere, but if things were to go wrong, and if we were to be confronted with many hundreds of thousands of people, and perhaps 5% of them were really quite ill, could the National Health Service cope with something like this?
Yeah, and it's the right question to ask, because whilst certainly we have maintained that there should not be panic or alarm, we must be prepared for an epidemic. We have to be prepared for a proper an outbreak, as we've seen in some other nations. So the NHS, has not had the sort of capacity to cope with winter pressures. We know that even in December we had record levels of waits in A&E and waits to be admitted to hospital. So we know that. What would need to happen is some pretty significant changes to the way in which we provide care. For instance, there may be a need to cancel planned non-emergency operations. So patients who may be waiting for a hip operation, unfortunately that may need to be delayed whilst the NHS gears up, or rather provides care to those who are in urgent need of medical attention due to the virus. So the NHS would have to reshape the way it provides care. We may need to, as you heard in I think it was reported in your own programme, the need to bring in a workforce of retired staff.
Yes.
There may need to be more isolation pods in hospitals, probably much greater levels of remote working. So I'm a GP in general practice. We may need to be providing much more in terms of telephone consultations and follow-up on the phone, rather than patients necessarily coming into GP surgery. We would need to prioritise care for those who are most vulnerable, that's the elderly and those with pre-existing medical conditions. So the NHS would need to shape up and provide care in a very different way, and there would of course be consequences to the way in which we provide care. So that, I think that's the best answer I can give, but those measures are being discussed as we speak, and rightly so, because we need to be ready.